मेरा फ्रेम ठीक आ रहा है?
Hi, this time I'm sitting with Dr. Ajay Nihalani, who is a well-known psychiatrist and runs his own clinic in Indirapuram. He is a senior psychiatrist with Max Hospital Vishali and runs his own clinic at Indirapuram Ghaziabad. He is a member of the Royal College of Psychiatrists UK, American Psychiatric Society and fellow of Indian Psychiatric Society. Today we are going to talk with him regarding schizophrenia. Welcome, Dr. Nihalani.
Thank you, Adarsh.
First of all, I would like to know what exactly is schizophrenia?
See, Adarsh, schizophrenia is a serious mental health condition, disorder slash illness, which tends to affect approximately 1 out of 100 people over their lifetime.
Okay.
It affects men and women equally. Usually starts between the ages of 15 and 35.
Okay.
It is characterized by the fact that the way a person thinks, feels and behaves changes.
How we react to the changes, that's what you want to say.
The way the person behaves,
Okay.
what the person thinks, as well as what the person feels changes.
Okay, Doctor, just tell me what exactly causes schizophrenia? What's the cause behind it?
See, the causes are multifactorial. What we know is that there is a major chemical imbalance in the brain that involves a chemical called dopamine.
Okay.
The other factors are birth defects, problems during pregnancy, early childhood, viral infections, stresses in one's life, and a positive family history.
Okay, and what are the symptoms of schizophrenia? How can you make out that
As I explained to you earlier, what schizophrenia does is it changes the way the person thinks, feels, and behaves. What that basically means is when we talk about thinking, we start using the term delusions. What happens is that the person starts believing in things that are not real. They are very real for the person himself, but it's very hard for others to believe and understand.
You would say it's a stage of hallucination.
No, not hallucinations. We'll come to hallucinations in a minute. What happens is the person might start believing the fact that people are after him.
Okay.
They are conspiring. The police is after them. The food is being poisoned.
Okay.
Things like
negative.
these.
Okay.
Then if we come to hallucinations, people start experiencing hallucinations, and hallucinations basically mean that what they hear, see and feel becomes unreal. They start hearing voices where the voices might talk between themselves, may talk to the person, they may ask him to do things, ask him not to do things, comment on his actions. Basically it's very difficult and annoying for the person. In a similar manner, he or she might start seeing things which are not there. For example, a person in the room who is not present, things like these.
Okay, it has got serious implications. What do you think is the treatment of schizophrenia?
See, the mainstay of treatment is medication. There are loads and loads of medication available in the market. What is very, very important is that the right medication is chosen for the right person at the right dosages and are continued for a prolonged period of time so that the symptoms recede. Apart from medication, what is very, very important is counseling the person, making him understand about the disorder, how it affects him, as well as the family as to how to handle the patient.
And how can we help ourselves, like if I'm suffering from schizophrenia?
As I mentioned, see, what is very, very important is the person who is undergoing the illness himself does not believe or understand the fact that the things that he is hearing are not real, the things that he is seeing are not real. So giving him the insight that this is not real, and if this starts happening with him, the illness is coming back. So he needs to take help, he needs to seek treatment. The other very important part is educating the person on the importance of continuing on regular medication.
Okay. Okay, and suppose I see someone in my family or near around who is suffering from schizophrenia. So how can I play a role in treating him, or how can I help him on this?
See, it is very difficult for family members when they see their own person change in such a manner that it becomes very difficult for them to understand as to what is happening with him. Because the person is experiencing these changes within himself. He may be hearing things, so he does not pay attention to what they say. He may things do in a very different manner. The person starts neglecting himself, neglecting his job, neglecting his personal as well as professional duties. His life gets disarrayed. Now, in such a condition, for the family, it is very important that they take the patient to the doctor, see to it that the patient is taking medication, and then help him recover gradually by giving him the opportunity to come back in a gradual manner. Not to put a lot of demands on him, not to be too critical. You can't do this, you can't do that. Earlier you were able to do this, you were able to do that. Why have you changed? These thoughts are not helpful really.
Okay. Okay. Thank you so, Mr. Dr. Ajay Nihalani. We'll be continuing our talks later. Thank you so much.
Thank you, Adarsh.